St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us on our health talk show with me, Maureen Kimani, right here on Capuchin TV, a program that is brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital, compassionate in healthcare, on every Tuesday from 9 a.m. and the repeater at 9 p.m., 9:30 p.m. at night. Well, today we shall be talking about pressure injuries. Maybe you have ever heard about this maybe word, but you don't know what it means. But we shall be able to expound on this topic about what are these pressure injuries, some of the risk factors, and what can be done to prevent them. And in the studio we have a guest who will be introducing himself in a very short time. But before that, let me just give you a very quick tip about these pressure injuries. Now, the global burden of pressure injuries continue to rise, but especially among patients with spinal cord, that is relatively very high. And we shall get to know, should we get much more worried about these pressure injuries, or is it's not that serious? Stay tuned, and in case you have any question about our topic today, you can send those questions on 0717-424-866, or you can use our SMS number, that is 21760. Welcome. Hello.
Hello.
How are you?
I'm fine, thank you.
You good?
I'm well.
Thank you so much for making time to come here on our health talk show.
Thank you so much.
Yeah, now because it's the first time you're here, right?
True, yeah.
Maybe you can introduce yourself to the guest and tell us what you do in St. Mary's Mission Hospital.
Okay, thank you so much. My name is KIPLIMO YEGO. I'm a nurse at St. Mary's Mission Hospital, and at the same time I'm wound care specialist. Thank you so much.
Mm-hmm.
Yeah.
When you talk about Rogers, I hope it's not Ken Rogers artist. Okay. Thank you so much for coming. It's a pleasure having you here.
Thank you.
Now, when you talk about these pressure injuries, I'm sure they have other names. We have bed sores, and some of which you'll be telling us more. Tell us, what is it all about?
Okay, pressure injury is at the same time known as ulcer, whereby it's an injury that develops on the skin, or a breakage on the skin, caused by maybe prolonged stay. It can be brought about by maybe communication between the prominent areas of the body, and whereby it ends up forming an ulcer on the when the body or the skin is in contact with the hard surface against the bone prominence. Yeah.
Mm-hmm.
Yeah.
Mm-hmm. And when you say about ulcers, what's the difference? Because we know we have so many ulcers with the other, like the stomach. Is it the stomach ulcers and these pressure injuries?
An ulcer, okay, I can say an ulcer is something that can develop suddenly and heal. But when it comes to the pressure injury, is an injury that develops in areas whereby most of the time is at a stage whereby you are putting more pressure on it, so it ends up forming a wound or an ulcer or a bed sore. Because it's called a bed sore because it's brought about when you stay in bed for long. Yeah.
When you stay for long, what do you mean the range of the time? How many hours? Because some stay in bed even for 24 hours, right?
Yeah.
Or maybe 20 hours, some 8 hours, some 4 hours.
It's true actually, because we cannot say it can develop in a normal person like you, because you can tell the changes that has happened in your body. But this one applies to people who are not they are not good. Maybe they have developed body issues. They have developed a fracture, and they have been advised not to move, not to do anything. So your only work is to, you are served lunch, then you stay in bed. But you are not able to change your body. You are just in a bed, you are being assisted by someone to help enhance the circulation in your system. But if you are not being changed or positioned well, the areas that are mostly at risk of developing asbestos are areas that are having high pressure. Yeah. Yeah.
And where do these pressure injuries occur?
Thank you so much. Areas that normally have a pressure injury depends on the position that the patient is on. In medical terms, we normally say the patient can lie in a supine position. We can say the patient is in a lateral position or an inner prone position. Why do I say so? To make my viewers understand, when we say the patient is in a supine position, you are lying on your back, okay? So when you are lying on your back, you realize that the pressure distribution in your body is changing. So when you lie down, one of the areas that is a chances of having a pressure injury is the occiput. Occiput is the back of your head. So you realize the pressure is being enhanced on your back. Number two, the shoulders. The shoulders are the areas again that develops the bed sore, because your distribution of pressure is supposed to be equalized. Equilibrium should be enhanced in your body. So another area that is at risk of developing a pressure injury is the gluteal regions, or people used to call it the buttocks, and on the lower heel. So you see the distribution of the pressure is all the way from the head downwards. And in terms of percentages, when the higher areas that is having the issue of pressure injury are the gluteal regions, it receives like 40 to 60% of pressure distribution. So, and when apart from that, a patient again can be positioned in a lateral position. Why do I say so? Lateral position is maybe you are being turned to lie at the side. Your side. So the distribution of the injury is on the shoulder, the sacrum, the knee, and downwards to the ankles. So when you assess those areas, you will differentiate. You will differentiate the changes from the normal skin. And again, when the patient is lying on the chest, so the chest is the area that is having the bed sore, the knee, and the toe.
Right.
Yeah.
And in case you have maybe these pressure injuries, we say for example in your knee, can they shift to the other parts?
I cannot say it can shift to the other parts, but you see, depending on the position that you are, we can have on the body, when I lie at the back, you see, even my spine, you can tell that the first area in contact with the surface or the mattress is the gluteals, the shoulders, and the back of your head. So those are the areas, because the bone and the heart surface is not in motion. You are the one to be in motion now. But if you will not be in motion, the pressure should already, it's upon the tissues. You are applying more pressure on the tissues. So the bone, the tissues, and the heart surface. So the heart surface is not in motion. Your tissues are the one that is being disrupted. Yeah.
Okay, and maybe you can tell us how are these pressure injuries formed?
Thank you so much. The pressure injury formed when there is more force. I can talk of the bones, I can talk of the tissues, and I can talk of the heart surface. So what is bringing about the pressure injury is, number one, you are being encouraged maybe to have a total bed rest, and without now, because you can be unconscious patient, you cannot tell that I'm in pain or not. So when the bony prominence areas apply pressure on the tissues and against it the heart surface, so you realize that the circulation in our system is is taking place every time. But because we have applied the pressure on the tissues, and the nourishment of the tissues requires oxygen, and the oxygen is being carried in the blood along the blood vessels. So we have applied the pressure on the tissues. We have cut off the oxygen and the nourishment by the blood. So these nutrients that is applying those tissues have been cut off. What do you expect? There is hypoxia, no oxygen on the tissues. Number two, there is no blood supply on the tissues. So when there is no blood supply on the tissues now start to die because there is no more nourishment, no more blood supply, no proteins for development of those tissues. So when there is more pressure on that, so those tissues die, then we are starting now having the issue of what we call ischemia. Ischemia is where there is no enough blood supply on the area. When there is no enough supply, tissues die, end up forming the pressure. And you can differentiate this by using maybe when you press your skin, you realize that you press it hardly, then you see there's a whitish formation there, then you release off your hand or your finger. So you realize that that whitish formation disappears immediately. That is what you call plungeable and non-plungeable. So when you apply pressure, it becomes whitish. When there's no pressure, the area is being supplied by blood. Same applies to the tissues that is being pressurized by the heart surface against the prominent areas. Yeah.
All right.
Yeah.
And before we go to the stages of these pressure injuries, maybe you can tell us who are at risk of having these pressure injuries or bed sores?
Thank you so much. So those who are at risk of having a pressure injury, we can have those patients, maybe patient have been involved in an accident, all of a sudden the patient develop a spinal cord injury, and when for you to perform everything or anything possible, spine is the key area. So you are being encouraged to have a total bed rest. There are those patients who have been sedated for long to undergo certain procedures, so you take time to come back or to recover well. There are those elderly people aged between maybe 65 to 80 having a medical conditions. Maybe the patient have developed a stroke. Patient has been having cardiovascular issues. And you see those are the people who cannot perform their normal duties daily. They need assistance. So even at home, you are supposed to see these people because they cannot tell. Maybe the patient has been having an issue of stroke, there is a history of stroke. So we need to assess for these people on areas that are mostly at risk of developing these things. We can have a patient or people who have been having we can have smaller children, neonates. We can talk of neonates above, not above, below 1 kg, 1.5. You see, these are the people that needs 2-hourly turning, depending on how patient is looking or what the condition the patient is having.
All right. And when I was doing the introduction, I talked about globally the rise case of these pressure injuries, especially the patients with spinal cord injury. When you say how common is it in Kenya, these bed sores?
It's a common thing in Kenya. Why do I say so? Because number one, people are not able to understand. You can realize that all of a sudden there is a bed sore or there is a blister forming at the back against those prominent areas. So you end up assuming, because when a blister forms, people tend to assume that okay, maybe this thing, maybe I use a wrong thing to change or moisturizing the skin, so you assume it. So and the thing, the pressure injury is developing from inside. It's not guaranteed that the pressure injury develops from outside environment or the skin. It develops. There's those that develops from the inner side, as it comes up. So number one, I've said people have to understand how is it forming, how are we going to manage, and if in case it's worsening, you tend to go to the hospital, take the patient to the hospital so that the doctor can explain on what is happening. So in Kenya, I can say in a group of, it represents 1.2% of people are having an issue of pressure injury, mostly the elderly people.
Okay. Yeah. And probably they can come to St. Mary's Mission Hospital because you can offer those services there.
Yeah, at St. Mary's Mission Hospital, we can as well say the patient has come for a clinic, and we can give a health talk to the family members to understand what is pressure injury, the causes of pressure injury, and if it's worsening, they are supposed to come back again, not to assume the pressure injury because it's you assume it and it's worse. Yeah, it can even end up you spend more from something that was not.
That's serious.
Yes, yeah, exactly. You see, so now you have spent, because you are supposed to have a consistent return date to ensure the wound is healing well. But when you assume, it end up complicating, maybe forming another problem of cellulitis, an issue of emboli maybe. When I talk of emboli, maybe you are being told now you're supposed to be admitted, being taken to a total bed rest, not to move. So you end up spending more. But in St. Mary's Mission Hospital, we give a health talk to all the patients concerning the issue of pressure injury, how to manage the pressure injury, and to console if in case they don't understand the pressure injury. Yeah.
And not only in St. Mary's Mission Hospital, that's where you give the health talk.
Yeah.
Also right here on Capuchin TV.
Yeah,
that's what you're doing.
Exactly.
You're creating awareness to the viewers and to other people. They can share these information and they can save lives and to help people not to have this complication with their bodies. Yes, let's now go to stages of these pressure injuries. I'm sure you can expound on it.
Yeah, thank you so much. When it comes to staging of pressure injuries, we cannot say only this is a pressure injury. But number one, I've said you are supposed to assess the patient. We do what we call assessment of the patient. You can have a pressure, maybe a wound, and you assume you call it a pressure injury. At the same time, it's not a pressure injury. We require what we call assessment of the skin. So when we are staging, we stage depending on the site and then the location. So number one, you're supposed you have a stage one, whereby it involves you need first of all to understand the arrangement of the skin for you to stage the different stages of pressure injury. Number one, the skin is arranged in a way that you can understand. It starts from the upper part. The outer part, which is not, it's dead tissues, which is it's not, you can feel the sense, but they are dead tissues. So it's epidermis, then we go to dermis, then we go to subcutaneous tissues, then we go to tendons, muscles, and the bones. So the first stage begins from the epidermis, whereby you can see there's a skin color, the discoloration. For an African, it's rare to understand because we our melanin is So for Americans or the whitish, you can tell the skin changes, whereby it becomes reddish in color. So when there's a redness or erythema on the skin, and when you touch it, the patient can tell you that I'm in pain. The sites that are much pain, the patient can tell you this area is so painful. And when you feel it, it's warm. At times it's cool. It's very cold, and I've talked of redness in the area. So this is the stage one. And stage two, there's a formation of blister now. There's a formation of blister on the side, no more redness of the skin. So when the blister forms on the area, at times it can end up even breaking, and it has gone now deeply involving the dermis. There's a formation of injury now, whereby it has gone to the dermis area. So from the dermis, the tissue are now being exposed. So you see, you can assume now and say, these are normal.
Especially
wound.
the blisters.
Yeah, the place that is a problem.
Yeah,
Exactly. So you're supposed to pick in here because we have the epidermis has been damaged. We have gone deeply to the epidermis. Yeah. So and it's you can see there's the serum is being produced there. Stage 3, sorry. Stage 3 now it has gone deeply to subcutaneous, whereby the fats are now being exposed, but there is no formation of what we call a slab. A slab are the dead tissues; they are not being involved there. And now the wound is so deep. It's so deep that you are supposed to see a specialist there. Stage 4, it has gone deeply, involving the tendons, the bones, and the muscles. And when you assess this stage, you realize that there is presence of pus, or we call it exudate. We have the patient is in a lot of pain. You can see there is presence of. You can assess well and see there is a tendons. You can check these tendons, these muscles, and the wound is enlarging, becoming so big. Yeah. Then we have a stage whereby we can have that cannot be differentiated if it is stage 3 or 4, unstageable. We call it unstageable, whereby the area has formed a wound. Then it is covered by something known as eschar. Eschar is a hardy black tissue that have covered the entire wound. So you cannot tell how deep is the pressure injury. So we stage it from 1 to 4. The fourth stage is worse than the first stage. And again, we can have the one we call deep injury. Deep injury tissue. So that one is involving from inside coming out. The patient is injured internally, but you cannot observe it externally. So this one, you can observe maybe on the changes. That's why I've said, as Africans, if you are not keen observing the skin, you will not differentiate it. Yeah.
So we need to pay more attention.
More attention, exactly. So the stages are from 1 to 4. Yeah, and we have the unstageable one and the deep injury stage. Yeah,
that's amazing. Now, well, thank you for that explanation and helping our viewer to understand about these pressure injuries. But we are going to take a very short break so that when we come back, we can talk about some of the causes and signs and symptoms that one can tell I might be having these bed sores. Especially, you talked about the blisters. Each and every one of us get these blisters, maybe through your toes, the heels, maybe in your hand. So if you don't pay more attention, you might find yourself being in stage 4. And that's why we're doing creating awareness, helping these people and our viewer to understand about these pressure injuries. Thank you so much, Rogers, YEGO, and we're taking a very short break. We will be right back up after a very short time, so stay tuned. And in case you still have any question, please send them to us so that we can be able to talk to you back and to help you understand more about these bed sores after this break. Stay tuned.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic broadcasting ministry.
Welcome Welcome back, dear viewer, to our Health Talk show with me, Maureen Kimani, and in the studio we have guest from St. Mary's Mission Hospital, that is Rogers YEGO, and who is a nurse there. And we're talking about bed sores, that is pressure injuries, in case you are joining us right here. And we have had some of the session where do these pressure injuries occur, and how you can tell that you have pressure injuries and what generally they are, and the rate where in Kenya, because globally it is a very high rate with the patients that are having spinal cord injury. Welcome back as we talk about some of the causes of these pressure injuries and signs and symptoms. And in case they can be prevented, that's what we shall be discussing. And still, in case you have any question, let us know. Welcome back. Welcome back, YEGO.
Thank you so much.
Yeah. Let's continue. Tell us, what are some of the causes of these pressure injuries?
The causes of pressure injury, Maureen, we can base on two factors. We can say we have the internal factors and the external factors. In other words, we call intrinsic and the extrinsic factors. Yeah. So when we talk of the internal factors, or I can begin from the external factors, whereby we can have for a pressure injury to develop. Number one, we have a pressure. As I've said earlier, what pressure can cause to an extent whereby the pressure injury develops. Number two, we have the forces, that is the friction and the shear. When we talk of friction, it's excess shear force that you apply on the when you are moving, or you have applied more pressure when sliding. I can use an example by saying there are those patients, they can be advised to elevate their bed to an extent of 45 degrees. Most of the patients, like those who are having an issue of cardiac issues. So the required angle that you are supposed to position the patient to avoid more pressure developing is a 30 degrees tilt position. But when you have applied 45 degrees, you want to move, the patient will move from the posture that the patient was towards the less raised area. So you see now the pressure is being applied on the gluteal regions, and the pressure that is a shear pressure, the pressure that's against the cervix or the mattress against the prominent areas. So when you move, you create an injury. The gluteal regions. So number three is that I've said a shear is a force, that a mechanical force that is applied against the heart surface, while the friction is more pressure force, more shear force that tears the skin away. So those are the external factors. When we talk of internal factors, number one is the age of the patient. How old is the patient? Okay, you can.
And what's the range of the
the elderly people actually, and those who cannot perform their normal activities, like those patients who are having an issue of neurological issues, as you have said, those patients having a spinal cord injury. Another thing is patients who are malnourished. Okay, let me go back to elderly people. Why do I say those people are prone up to pressure injury? When you get old, your skin tends to change. You are undergoing many changes as per the body. When the body, your skin is becoming thin, it becomes wrinkling. So when it wrinkles, now when you are lying down, because when you compare the elderly person and the adult one, the skin is different. Ours is shiny, you see, because we are getting enough exactly, compared with the elderly people. So number three is malnourished people. Why do I say it? You need more hydration. We are taking more water. Why do we take water? For the purpose of skin being moisturized, okay? But if you are not getting enough diet plan required for the skin healthy, then it means that you are not achieving the required what? The body will not respond well, because if our body can perform mechanical ways of functioning. Because if you are not having enough fluid in your system, the body will prioritize areas that majorly needs more fluids. Then we assume the others, because if your brain needs more hydration. So malnourished people are at risk of developing this pressure injury. Number 2 are the immobile. They are the same as the patient, because if you are elderly, you cannot move, because a person who is 100 years old and the one who is 30 years old, who can perform more activities. Then for the 100 years old patient or person is only to have a rest, isn't it? Yeah, so the chances of, because the gluteal region, I've said, the gluteal region receives a percentage of 100% of pressure injury. You are sitting down, because in our villages we assume that those who are elderly, we under the tree, you sit down, wait for your lunch, then we serve you, the day end. Yeah, so this, when you assess those people, you realize that there's a changes in the skin on the gluteal region. Yeah. Last are the patient who are, I've said the spinal cord injury patient. We have the smaller one, the neonates, whereby the mothers, if you discharge the mother after being the child has been admitted in hospital, maybe it was a low weight patient or patient was small for gestation at birth. Then as nurses, we only do, we deal with the baby, not comparing with the mother, because mothers can assume that you know everything, so they're expecting us to help them. So when we discharge them home, they never saw that we were turning the patient. You see, they go home not having the knowledge. So they go and assume that, okay, you put the baby on the bed, you left it there until the time the baby cry, you come and that's the time now we come and help. Yeah, exactly. Those are now the 4 people who are at risk of developing the pressure injury. Actually.
We have elaborated. And what are some of the signs and symptoms of these bed sores?
When we are doing the assessment for a patient who is having a risk of pressure injury, I've said number 1, we score. We normally score the patient from 4 to 24. When you have 24, that is a high, very risky patient of developing pressure injury. So when we are assessing the skin, number 1, you are supposed to see the skin color. There is a skin color changes on the prominent areas of developing pressure injury. You can see there is a reddish color on the area. Number 2, you can see that the area that is at risk of developing injury is an issue of pain. The patient can localize the pain. That why do I have more pain on the gluteal region, on the shoulders, on the occiput region than any other region? You see, the verbalizing of the patient saying, now I'm having an issue of pressure. You can diagnose as a doctor that this patient is at risk of developing injury by assessing the color, the localization of the pain by the patient, and at the same time it can form a blister. If you will not realize that thing, it develops a blister. And the blister forms on the shoulders, on the occiput, on the knee region. Yeah. Number 3, you realize that if you will not be able or understand the location of the pressure injury, you realize that at times it can even, you cannot tell if it's a pressure injury, but it end up forming something like a wound and start forming pus inaanza kutoka from the side. That is the signs and symptoms of pressure injury actually. Yeah.
Wow. And after having these signs and symptoms, maybe after finding out that this patient might be prone or is having these pressure injuries, how do you diagnose it?
the approach that we normally use when we have realized the patient is having an issue of pressure injury. If the pressure injury is stage 1, you majorly give a health talk to the next of kin for the patient, or if the patient understand. If you can help talk the patient and is able to understand, then you advise on what they are supposed to do. Okay? If stage 1, you tell them, okay, you are supposed to off the pressure from the side. Okay? After every maybe 2 hours, 3 hours, you are supposed to be in motion. You are supposed not to sit down. Okay? You can perform your exercises if you are able. Okay? But if they are not, the best thing that we advise them based on their cardian, the next of kin for them, to assist them. Okay. Another thing, you can, because the best thing for pressure injury is a body massage. A body massage can enhance the circulation of blood within your system. Yeah.
So we should be getting that quite often.
You can once in a while, but for people like us who are active enough, why should we go for? Because our bodies can perform normally.
We save that money for something else. The economy is very high.
Yeah.
Okay, let's talk about the treatment of these athletes.
Thank you so much. At St. Mary's Mission Hospital, what we normally do, once you assess the patient, because actually I'm working in female surgical ward. Okay. Once you assess the patient and realize the patient is having an issue of pressure injury, it's a multidisciplinary approach, whereby as a specialist you cannot work alone. You work as a team, whereby we normally involve the nutritionist for the purpose of the diet. We normally involve the physician for the purpose maybe the patient is having an infection. There is a lab technician here. We have the surgeon, neurosurgeon, if the patient is having an issue of the spinal cord injury. We can have a plastic surgeon, whereby you come up and discuss concerning the patient. If the patient is having an issue of low, okay, we can involve it again to a specialist, a blood specialist, yeah? Whereby when you do an investigation of a patient and realize that the patient is having a low HB, hemoglobin level is low, what is our main priority? The patient to be transfused first. Because blood is the key area of concern for each and every wound. Every kidonda ile kupona requires enough supply of blood. So the management of pressure injury is based on the four stages. Yeah. So for stage 1 is primarily you do, if not worse, you just advise the patient. We do 2-hour returning of the patient if the patient is having a medical condition apart from what has transpired to an extent that this pressure injury is developing. We treat the cause, then we get away with the pressure injury by treating. Maybe the patient was having an issue of cardiovascular. Maybe the patient was having an issue of emboli. So when treatment of stage 1 is different from stage 4. As a wound care specialist, what we normally does is we have a special dressing material. You assess the wound. It contains more exudate. We check for the dressing material that has the dressing material is made up of maybe antimicrobials that will control the bacteria, or if the patient is not having an issue of infection, we go for the dressing material that can absorb the excessive exudate. If it cannot, then we involve the surgeon. We go for what we call debridement. Debridement is a situation whereby you are supposed to remove the slough or the necrotic tissues to expose the healthy tissues. Okay? After you have exposed the healthy tissues, we now come and say, now we are supposed to use a specific dressing material to promote what we call epithelialization of the tissues. First of all, you off the pressure from the side. Why? If the patient was on maybe the normal mattress, we advise for maybe the cardian to buy what we call repo mattress. A repo mattress will maybe it can work as a massage because you inflate and deflate. So, as by what I've said on the management, we based on the stage of the wound. The worse the wound, the management becomes very thorough and we assess after every day. We can advise for dressing twice a day or once a day, depending on the material that has been used for the dressing. Because we can have the material that can stay for 5 days, you change. We can have those that can stay for two days. And these materials can promote moisture of the area, controls the exudate, and number 2, it applies the antimicrobials to the side, whereby those tissues now will start developing because you have put a low off pressure from the side, actually. Yeah.
Okay.
Yeah.
All right. And after maybe this treatment, we understand that any medication that is administered to a patient might be having these side effects. What are some of the complications to these pressure injuries, maybe treatment to patients?
The complications, thank you so much. The complications of the pressure injury, I've told you, it starts from the smaller, heading towards the worst part. So number 1, you can have what we call the cellulitis, whereby it's an infection of the skin. When you cellulitis, you can assess and say, this patient is having cellulitis. Why do I say so? The area affected is having an edema. The area is shiny. When you palpate the side, you feel there's a warmth. You see, there's a lot of pain. Number 2, it has already communicated all the way from the epidermis. Now we are in the tendons, muscles, all the way to the bones. So the patient can develop osteomyelitis. That's a long-term complication. At the same time, those are the infection of the bones. So you realize that the patient is in a lot of pain. There is a osteomyelitis here. There is a cellulitis. And at the same time, it ends up forming an infection, actually, whereby the systemic infection of the body.
Okay.
Yeah.
And are there some of the ways to prevent these bed sores?
Yeah, very true. I've told you, the prevention of pressure injuries, number 1, we advise the patient not to be in one position. You can hear somebody saying, I'm not comfortable when I'm not lying on a supine position or the lateral position. But for the best of your body, you are not supposed to lie on one area for long. Number 2, you can talk of body massage. Here we involve the dermatologist. In St. Mary's Mission Hospital, we have the dermatologist, whereby the dermatologist will describe maybe a specific moisturizer, which specific gel can moisturize your skin well. Number 3, you are supposed to hydrate yourself, take more water. Yeah, water is not an harm to our body. You can realize someone can stay for 12 hours without taking a glass of water, and you are advised to take 8 glasses of water. So I don't know if Maureen, you are taking 8 glasses of water.
I do, but more because it's very cold, I prefer warm water.
That is it. At the end of the day, we have just hydrated our body, because when we take more water, our skin becomes moisturized. So for the skin, when the skin is dry, the chances of forming a crack is high, and the crack will communicate to the wound, and the wound will again becomes worse. So you tend to spend more treating the cause rather than preventing the situation. So I've said dermatologists will work on the side of advising on the best moisturizer to use. Number 5, you are supposed to not only in terms of exercising, but I've talked of body massage. I think I've told you that. So those are the things that you are supposed to do and to promote the issue of pressure injury control.
Okay. Yeah. Thank you so much. And before we wind up, I have some few questions here. We have one that says, I had a pressure ulcer before. What can I do to reduce my chances of getting one again? We can tackle that.
Yeah, thank you so much. The issue of pressure ulcer, if our client, maybe she had an issue of pressure before, when the pressure injury heals, it heals for unless she was having an issue of medical condition or there was a cause before it led to pressure injury. So on the issue of not to recur it again, I've told you, you rehydrate yourself, you do an exercise. If she was staying on maybe sitting for long, you are not supposed to sit for long. Yeah, that is because what the main thing that we need here is the circulation, 100% circulation to our entire bodies. Yeah, that you. Yeah, exactly. So.
Getting some massage.
Exactly.
Right. Thank you so much, Rogers, for making time and for enlightening our viewer on these bed sores, pressure injuries or pressure ulcers that we have been talking about. And in case to you, our viewer, you just missed some of these parts that we have been talking about, you can always follow these conversation on our YouTube, our Facebook page, and you can as well share to your friends and to your family members to follow this conversation as we wind up. Maybe to you, Rogers, if in case you have something to your parting shot to tell our viewer, maybe how they are supposed to take care of themselves, and in case at St. Mary's Mission Hospital, if a patient was watching us, when they can come to visit the hospital to have these services.
Thank you so much, Maureen. Pressure injury, I can tell the viewers that pressure injury is not something to assume. As you have heard, it's one of the global burden condition. Our elderly people are much important for us. We don't assume as usual. And you're supposed to visit maybe a doctor twice in every 3 months. For the issue of screening to ensure that maybe you are free from the risk of developing pressure injury. We at St. Mary's Mission Hospital, we normally advise our clients. They can come for a maybe clinic, medical clinic, maybe surgical clinic. But we chip in as a specialist. We give a free health talk concerning the issue of pressure injury. Apart from even pressure injury, what are other issues that can at risk of developing pressure injury? So if we advise we give a health education on the guardian or the clients concerning the issue of pressure injury. Even when they are at home, they are able to manage the pressure injury risk factors, yeah? Because you understand it. But if you don't understand it, you're assuming that your elderly person is okay, but inside the patient, she is complicating. So you end up rushing and saying, no, this has happened, no, I want this, you see. But if we understand what is pressure injury, give health education, we advise them to rehydrate thoroughly. But if they are not well off, they are free to come to St. Mary's Mission Hospital. We give an affordable health-wise, yeah.
Wow.
Yeah.
That's amazing. Thank you so much, Rogers, and for making time, as I said, and for this conversation and enlightening our viewer on this topic. And also want to say thank you to Capuchin TV crew that has been of success of this show, Health Talk Show. That is Christopher Odhiambo. We have Eric Otieno. And lastly but not least, we have Michael Kibandi, who is our transmission manager. May God bless you all. And not forgetting Lydia Chanya, who always makes sure that we have a guest every Tuesday just to create awareness of everything that is happening around us. Thank you so much, Lydia Chanya, who is the marketing officer of St. Mary's Mission Hospital. May God bless you. Have a nice time. See you next time, and goodbye.
Thank you so much. Have a good day.
Okay.
All right.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.